terminology or the language of movement. And we're going to be moving from the shoulder, which we covered in the last video, down to the elbow, the wrist, and the hand. We'll lump those all together. We'll start with the elbow, because that's a pretty easy one. I'm in my sort of anatomical position here, and I'm going to move into elbow flexion and extension. It's a hinge joint, that's all we need to worry about. So we go into elbow flexion, it's on the sagittal plane, I'm moving forward, and then I move into elbow extension to go straight. This is full elbow extension. Okay, that's full elbow flexion. It's usually between like 130, maybe 150, depending on how much bicep tissue you have. Elbow flexion, elbow extension. Where we run into trouble is if your elbow joint is hypermobile and you can go past straight and actually hyperextend from the elbow. You want to be really careful of that because you're going to stress the connective tissue that stabilizes the elbow. We want the elbow to stay stable. Instead of stressing that connective tissue, engage the muscles around the arm. Where this becomes a really big issue is when people do chaturanga. So when we're lowering down toward the floor or toward half plank and your arms are just weak, or you're trying to hold a full plank and your arms are a little bit weaker than they should be, especially with beginning students who aren't used to doing a ton of weight bearing on the arms. As soon as they come into a weight bearing position, and I'll just go with table, they're going to, that's about as much as I can hyperextend my elbows. But you can see I'm kind of bowing forward here, and what happens is these muscles don't have to do anything because I'm just hanging out on the joint locked. But if I slightly micro bend my elbows, then right away I can feel the muscles around my arms start to engage. I have a much more active version of my pose like that than I do locked out in hyperextension. Same thing goes for the knees. If your knees are locked, you're really not engaging the muscles in the rest of the leg. So try to avoid that locked position. But it's elbow flexion, and you move down into elbow extension. So when we're in tabletop pose, we're in full elbow extension. Don't go into hyperextension. When you're in a plank pose, you are in full elbow extension. Keep a little micro flexion so that you don't hyperextend. Okay? Then when we start to bend down, we go into elbow flexion for that half plank or to move toward chaturanga. But the one that I really like to use to practice this is called drinking lion. You're going to start in table, get nice and neutral, exhale elbow flexion, tap your forehead to the mat, inhale press the palms into the floor to come into elbow extension. Elbow flexion, elbow extension. Now I'm also in 90 degrees of shoulder flexion in order to get this table to happen. And I mean 90 degrees of hip flexion, but we didn't get there yet. And try to keep the rest of the spine pretty neutral. Don't protract the cervical spine. Your scapula aren't protracted or retracted. They're sitting right about neutral so that the chest and the upper back are pretty even. And the fingers are spread wide. Elbow flexion, elbow extension just to neutral, don't hyperextend. Now, we'll go down to the forearm. And the forearm is really interesting because it adds to what I call the spiral of the arm. We talked about how the ball and socket joint in the shoulder, the glenohumeral joint, allows us to internally rotate and externally rotate, which by itself creates this amazing spiral of opening and closing. But the forearm is going to add to that process. And if you come into neutral with the arm, but then hold the distal end, the lower end of your humerus, just above, so just proximal to your elbow joint, throwing all sorts of anatomical terms at you. Hold on to your humerus, keep it stable, and then rotate your palm behind you, rotate your palm forward. So you feel how that rotation happens completely independently of what your humerus is doing or what your glenohumeral joint is doing. Rolling in and rolling out. So we know from the last video that that movement of crossing the forearm bones is called pronation. Uncrossing the forearm bones is called supination. And I can do that with my elbow bent as well. Pronate, palm down. Supinate, palm up, like I'm holding my bowl of soup. But just notice that the hand can turn without anything happening up here. Okay, now pronation and supination usually do kind of go with some of that rotation of the shoulder. Especially, I love to do this kind of accordion shaped movement where I open back. I'm reaching my arms into external rotation, which feels great. It's opening up my shoulder, it's spreading out the collarbones, and it feels really good to be in supination like that, to have the palms up. I can keep my shoulders in external rotation and pronate my palms. It just doesn't really feel right. It's not going to hurt anything, but it feels much better to be in supination when you're externally rotating like this. So, supination, pronation. We do a lot of pronated poses with the palms down toward the floor. And you know that it's pronation because my forearm bones are crisscrossed instead of having them parallel. Okay? Radius and ulna are sitting right next to each other. The radius is crossed over the ulna. That's the difference there. That's the only movement that we want to really worry about with the forearm. So then we can go down to the wrist. And we know that the wrist does all sorts of things in yoga, and it can be a spot for some trouble when we're doing our practice. It's also a little bit confusing to understand which is flexion and which is extension. Very easy to confuse that. The way that you can keep track is it's easier to remember the shoulder, right? We go shoulder flexion, forward on the sagittal plane. We go shoulder extension, back on the sagittal plane. The wrist is the same thing, but make sure you're in anatomical position. So it's wrist flexion, forward on the sagittal plane, wrist extension, back on the sagittal plane. Now hold that wrist extension, swing your arms out in front, put them down onto the mat. When we're in prone, when we're in tabletop, when we're in downward facing dog, all of those things, we're in wrist extension. And when the wrist is fully extended, it can be rather vulnerable because the ulnar side of our wrist, the side right by this little bump, the ulnar styloid, there are some really sensitive ligaments that create this network on that side of the wrist. If we push lots of pressure into it, those ligaments get mad at us. So we want to try to keep the pressure toward the base of the thumb and the base of the index finger in this triangle right here. So same thing on that hand. When you have your palms on the mat, distribute more of your weight toward that side of your hand, toward the thumb side of your hand. It's going to keep the outside of your wrist from getting cranky. Okay, so we have wrist extension, wrist flexion. Sometimes we'll do a wrist flexion stretch on the mat, like so. It's a good way to open up the muscles on the top of the forearm. Circumduction. Very nice to loosen up your wrists before or after doing weight bearing on the hands. If you're getting ready to do some arm balances, circumduction gets all the muscles that work around your wrist joint. Now that one kind of strange movement that our wrist does is ulnar deviation or radial deviation. Radial deviation means moving sideways toward the thumb. Ulnar deviation is moving sideways toward the pinky. I'll show you from anatomical position. It's radial deviation, ulnar deviation. Just named for the bone that you're moving toward. So if you remember which forearm bone is located on which side, you'll remember that movement. Most of the time, when we're doing our yoga practice, we want the wrist pretty close to neutral because that's the most stable position. When the forearm and the middle finger line up with each other, That's where the wrist is going to be the happiest. When we start to do a lot of bending side to side, again, we can aggravate those delicate ligaments on the ulnar side of the wrist. So you want to try to keep an eye on the hand and make sure that you're spending most of your time pretty neutral. Don't go into ulnar or radial deviation too frequently. All right, so the wrist, we have extension and flexion. I flipped my hand around because that might have confused you, but here I am in neutral, right? Flexion, extension. I'm going to turn my hand over, extension and flexion. So it's extension when we're down on the mat. Play around with those so that you make sure that you remember them. Circumduction, radial deviation, ulnar deviation. Now my forearms are in pronation because my palm is down. My radius is crisscrossed over my ulna. I'm going to go into supination. My palm is up. I'm holding my bowl of soup, and my forearm bones are parallel to each other. One of the movements that I really like to do with supination and external rotation, where they go together so well, is I keep my elbows into my sides and I just hinge open like a door. Okay, so hinge closed, hinge open. Feels great having the palms supinated when I do that hinging action. And then I can add in a little cervical extension and thoracic extension. Take a big breath. Release the hands down into pronation, release the arms down. So that brings us down to the fingers. And I don't like to get super particular into the fingers. For basic yoga teacher training, you don't have to be really, really technical. But know that the fingers are in extension, they're in neutral. Just like the elbow is in extension when you're in anatomical position, the fingers are in extension and adducted, they're adducted. Okay, so they're straight together like that. The fingers can go into flexion. Think of just making a fist. That would be composite flexion. It's flexion at each of the little finger joints, and the thumb gets to do a little bit of flexion as well. Extension, you're straightening them out. Flexion, extension, you can do flexion of the fingers individually, and you can do flexion at certain joints. So I can flex from there, I can flex from the end, I can flex my thumb, and then go back into extension. There's abduction, abduction, moving away from the center line of the hand, which is the middle finger, and adduction is pulling my fingers together. We spend a lot of time in yoga abducted and a little bit of finger flexion, just a little bit. When you're down on the mat, that slight finger flexion is going to help to activate the muscles around the hand and around the arm to stabilize the wrist joint and to protect the fingers from injury. It's also a way to activate the muscles in the rest of the arm. When you're creating intention in the fingers, then the rest of the arm is going to follow and it's going to be really actively engaged. If the hands are like wet noodles that you just slap down onto the mat, the arm is going to do the same thing. The muscles aren't going to be actively engaged. You're going to be dumping weight into your joints and relying on your joints to stabilize you rather than using your muscles. So keep that in mind. It's a little bit of finger flexion from the very fingertips, like you're trying to grab the mat gently. That's going to emphasize the arch in your palm too. And we know that things that are arched create strength. So when we arch the palm, we're utilizing that strength that we can create with the hand. Same thing goes with the foot, but we'll talk about that later. Okay, so finger flexion, finger extension, finger adduction, finger abduction. The last one is thumb opposition. And thumb opposition is important in yoga because we use it to do mudras. It's the ability of the thumb to swing over toward the palm and tap the finger. Opens, swings over toward the palm and taps the end of the finger. Thumb opposition is one of the things that makes us uniquely human and allows us to do complex fine motor manipulations like buttoning things, closing zippers, picking up little tiny things off the floor. Thumb opposition. And it gives us these really beautiful mudras to help to concentrate and focus our energy. The other movement that the thumb does that's a little bit different from the other fingers is that we can do radial abduction and adduction. We can also do what's called palmar abduction and adduction. So it's just the difference of moving in that plane or moving in that plane. Okay, the other fingers can't do that. They just go one way. But that's why our thumb is so special. It allows us to do so many different movements. And when we're doing our yoga poses, it's going to be that side of the hand that's more stable. It can take more of our weight, but be very careful with the base joints of the thumbs. Don't put too much stress in the thumbs, especially when you're doing one of these tented finger things. Don't dump your pressure through the thumb, because this is the joint where almost everybody will end up getting arthritis eventually, because we use our thumbs so much that they get worn out. So be nice to your thumbs, try to use blocks instead, and you won't get as much arthritis pain in those thumbs as you get older, hopefully. Okay, thank you for joining me. Namaste.